Hi, this is Pam Dunwald, and we are with Your Nurse Advocates Consulting. As well, we have another advocate, another expert in our field. So we're also going to be sharing this on our Patient Advocate Match directory, where we have a directory of healthcare services that you can reach out to and research and find someone that might help you reach your healthcare goals. So today we are visiting with Michele Mosier, and she is a PharmD. And what does that mean? That means she is a pharmacist with a big degree. But
that's it, Pam.
And a lot of education. So Michele, she has Hope Health Advocate, how she got started in advocacy, and as a pharmacist, what kind of ways that she can help her clients. And then we're going to get into a little bit of examples on how she can help as an advocate, and we'll go from there. So Michele, welcome, and go ahead, please tell us a little bit about yourself and how you got started into advocacy.
Thank you. So excited. Thank you. It's an honor to be on your program here today. And I was a pharmacist, like a traditional pharmacist for about over 2 decades. I was in the retail environment for about 10 years, kind of switched to the PBM world. So for those of you that maybe don't know what that is, it's the insurance side of things. So I would either approve or deny medications for coverage and things like that. All this time, I kind of felt disconnected. I felt I was kind of sticking out, where I always wanted to still do quality work and make sure that the people that I was, taking care of, whether it was reviewing for their medication or, face-to-face in the retail environment, I always wanted to make sure that they were always taken care of with quality care. Well, I began to realize that with the numbers out there that were expected of you, that was not always the case. And so I really didn't feel as if I was really helping people. And that's why I wanted to become a pharmacist from the beginning, was to feel like I was helping people. So that there has to be a better way. So while I was searching through and doing all these different things with my career, my uncle had 2 strokes, and he's never been married. He was never married, never any children. And so it was kind of like, tag, you're it. And I was that person who would go up to the hospital and visit with him and make sure that his needs were carried forward and his voice was heard. And if there were problems, that I would try to, if he was getting stuck up there one way or another, I would try to figure out how to get him unstuck, or if he was feeling unheard, make sure he was being heard. I joke and say I was kind of that person, like they saw me come in and I think they were like ducking, like, oh, here she comes again.
Ankle biting dog.
Yeah, that's right. And whatever I was at that time, I honestly, Pam, didn't know that it was really called patient advocacy. To be completely honest, I just thought, whatever this is, I'm feeling very energetic and felt alive again. Like I was really doing good again. So fast forward, I was on LinkedIn and I saw a pharmacist, Claudia Cometa. She actually she does this work as well. And she was offering a course in this of like how to get kind of started. And I thought, well, and of course she named it patient advocacy at the time. I was like, this is what I was doing. This is what, and so one thing led to another. I ripped the Band-Aid off, and I thought, I recited in 2001 when I graduated from Duquesne University. Part of that oath that we take as a pharmacist was to embrace and advocate for changes that improve patient care. And I thought, what better way? Mm-hmm. So, so I said, that's it, we're doing this. And as a pharmacist, takes a lot, because Pam, I'm sure you've worked with pharmacists. We're very black and white. And like, if there's 30 tablets in a bottle, it's supposed to be, there better be.
Very smart. Very smart. Very smart.
Yeah, thank you. So, it was that kind of gray area of doing, entrepreneurship. And, I'm in my 40s. I thought, man, am I too old to do this? And so I just thought, you know what? I started then to think, maybe this is a divine thing, like where, I'm very spiritual. And I thought, what better way to serve him by serving others, too. So there was kind of multiple reasons why I kind of just kept going this way. Awesome. So sorry for such a long story.
No, that's, that's so important how we get in, and people can hear your passion. People can hear, in your voice that how much you enjoy, serving and caring for others. So as a pharmacist and as an advocate, what are some of the ways where you feel that you can make a big difference?
Absolutely. Thank you for asking. Because I do feel that that's a big puzzle to some people of like, okay, what's a patient advocate and how can a pharmacist kind of add to benefit the patient or our clients? I would say the very first thing would be that we prevent adverse drug reactions. And just to geek out a little bit, I do want to say a quick little study, but nearly 1 in 4 people, so that's approximately 23%, have a preventable adverse drug reaction and this was based on a large retrospective study in a primary care setting. And the population size was 1,568,164 individuals.
So
Now,
significant.
for those, so for those that don't know what an adverse drug reaction, let's be fair, some people may not know what that is, right? So it's really any unintended harmful event that is basically due to the use of a medication. So, it can be, and a lot of times those can be problematic and lead to like unscheduled hospital admissions and things like that. So we should all be very interested and wanting to prevent these type of reactions if we can. So I'll just give one case example, or is that okay too?
Yeah, absolutely. And
okay,
before we do that, I do have one thing
sure.
maybe to ask
Yeah.
that. So how would someone know, or what would be a red flag to them to think that they might need help or might need some to help prevent? I mean, what would someone be looking at that you could help them with the adverse drug reaction?
So, and that is the tricky part. Sometimes people don't know. So I like to say that when they start a new medication, that they should report. Well, first of all, education is key. So when you start a new medication, you're hoping that a pharmacist somewhere along the line says, hey, these are the things to look out for. And then, hey, oh, I remember the pharmacist said, like, I need to watch out for this. This could be a common thing that is seen with this type of class of medications or this specific drug. Like, for example, like a statin drug for cholesterol. We know that it can be very harmful to muscles. It can do myopathies and cause muscle breakdowns and such. So we should be counseling that patient, like, hey, report any really like strong muscle discomfort, any weakness, pain, things like that. So, but that's why we're needed, because, people don't know what to look for. I would say if you don't have that privilege of having a pharmacist in your corner, I would say if you just start experiencing something outside of your normal, maybe start, go to your physician, and then they can look at maybe, was there a new medication added? Or it could be something that comes up, surfaces down the road, too. So that's a great question, but it's really hard to answer.
And it brought an example to my mind. Many years ago when I was in home health, we had a patient of ours on our client load that we were servicing in home health, and she was started on a statin drug. She had a myopathy. I mean, it was so bad, it put her in the hospital. They took her off her statin drugs, but then they discharged her home and put her back on again. And she really didn't have anybody to advocate for. So
there you go. It's so important. You are so right. And my uncle that I was speaking of, he had a statin. He said all of a sudden he had a walker, and he had like a little seat he could sit down on when he got tired, if he, because he was in a assisted living at the time. And he said, he called my mom and he said, all of a sudden I just can't, my muscles aren't holding up. Like he didn't have a medical background, so it was hard for him to verbalize it. But he said there was something with my muscles, to my mom or his sister. And then I said, let's look at his drugs. And I said, right there, so And once he got off of it, he was able to, he regained some strength. I'm not saying that's going to be everybody's situation, obviously. Don't want to ever misspeak here, but it's important to know these things. So, but yeah, and how pharmacists can help prevent them. But I already said an example, so I guess maybe I don't really need to say another one there. So
I mean, you can, I think if
yeah.
you'd like.
So, well, what was really, this was, because this was in the patient advocate, area. And I was working with another nurse like yourself, and I was looking over any of her new clients that would come in. I would look at their medications to see, you know, how did they look for them? Like you said, there's a list a lot of times. And so I try to go in there and try to, you know, make sure they're optimal for that particular client or patient. And I said, so once I got through that initial look at on all their big list, I said, okay, so going forward, if there are any new medications, reach out to me. I'll be happy to do another look and see, you know, hey, is this going to be problematic with any of the medications? And, you know, again, educating what to look for. Well, this particular client of the nurse was starting to get some urinary problems, overactive bladder, and was given Mirbetriq. And for the overactive bladder. And I knew, just because you know, one of the major things with that medication is an adverse effect, and it's hypertension or high blood pressure. For maybe people that don't know that, we know it, but and so I knew that. And as a matter of fact, it's like they don't recommend it at all if it's if you have uncontrolled hypertension. So they only really recommend it in people that have well-controlled or not so bad hypertension. And I said, go to your client and make sure because they had control. So I said, make sure you tell her to get her blood pressure monitor out while she's beginning this new medication, and see if there's any changes to the blood pressure. Sure enough, she's like, you're magical. And it felt so good. And you know, that I was like, see? And so then here, sure enough, her blood pressure was going up, and right then they knew, because I had told them, hey, look out for this. And they switched it immediately. And so like, that's the kind of person who could have, you know, they could have gone to their cardiologist and said, increase my blood pressure medication.
Yes. And then we start that whole
and then we're in this whole cycle.
Yes.
And then that's too much for them. And then they're going to fall and break something. And so it's just a cycle of things, you know, that,
yeah. And I think that's a really good segue into talking about polypharmacy. And I know that's another area where you can help.
Yes. So that's the second. Thank you. Great lead in for that. But I definitely feel like pharmacists can help reduce the dangers of what they call as polypharmacy. And 3 points to like kind of what polypharmacy is for those that maybe don't know. The numbers I kind of saw, like it differed. Like, so I saw where it said 5 or more medications at the same time, but it doesn't have to be 5 or more. It can to be polypharmacy. There's other ways to be polypharmacy. You can be taking a medication that combats the side effect of another medication. That's polypharmacy. And you could be using it. You can be using it in excess, or like anytime you're using something in excess or like clinically unnecessary, that's polypharmacy. So it's pretty broad, and I can tell you it's very easy to fit into that. It's most people, I feel like, fit into this polypharmacy. So I don't know that's necessarily anyone's fault in general. I don't know that patients or clients, you know better, to be honest. And I think that doctors are under tremendous pressure with time that they're given to, you know, sometimes I just think it's easier for them to say, hey, I'm just going to give this medication. Oh, you're having some GI side effects. Okay, I'm going to just give this now to combat those side effects. Instead of maybe, you know, taking another look, and maybe there be another alternative that might be better. But so this is a crazy statistic on this one, if you don't mind me sharing.
Sure.
Okay, so there was a study that I found that there is a 3% increased risk of death with each medication added. Now that's crazy.
Wow.
Now it was in a little bit of an older population, so I want to make sure I say fully that it was based on a Newcastle 85 plus study. So and there was only 741 patients. So it was an older crowd for sure, but I was like, wow, like, I mean, that's pretty substantial.
Well, yeah, absolutely. Because when we look at that population, they're in a population where they're subject to high risk medications to begin with. So
yes,
they're so
yes,
vulnerable.
absolutely, absolutely. I can say my example on this one, and this was with patient advocacy as well. And I think it falls more into that it was a medication given to combat the side effect of one medication, which then led to the excessive and clinically unnecessary medication after a certain period. This happens all the time. So it is Ozempic, and that particular class of medications is very, 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 it's a common to have GI. Gastrointestinal side effects. It's one of the main side effects of that entire class of drugs. And so, and dyspepsia and things like that. So a lot of times that, a provider will give like a pantoprazole, or they're called proton pump inhibitors. So Protonix or pantoprazole, one's the generic, one's the brand name. And so generally to help them get through that initial GI discomfort. Well, then after, months later, they're still taking this Protonix or pantoprazole, whichever way you know it. And that there are studies out on the long-term problems with taking these PPIs. So it's not, these medications need to be respected and taken for only as long as they need to. I mean, the Ozempic and things, those GI side effects should go away over time. So definitely reassessing. So if you're going to give a PPI, have a plan in place, right? Like how long are we going to give this to my patient, for what dosage, and when are we going to reassess? Reassess is so important. Once again, I don't believe it's anybody's fault. It's just a matter of, the patients are calling in wanting refills. Okay, great. I'm going to refill it. And sometimes we just forget to do that reassessment part. But yeah, so the long-term problems are, bone fractures. Some of them are, I'll be honest, some of the studies are a little bit for the long-term problems with the PPI usage. Like I think there was dementia was mentioned recently, but there's been some studies that have gone back and forth with that. But there's definitely been, some definite long-term issues of continued use of those PPIs. So that's one that I'm always focusing on when I look at someone's profile. Okay, I see a PPI. Do they need to still be on this PPI? There are some times that yes, they do need to be. Like a GI bleed or things like that. But Pam, as well as I do, a lot of times it's time for, to cut it down some and see if, coming down off of it is appropriate.
Great information. And, it's so needed. So thank you for what you do.
Sure.
How, if someone wanted to utilize your advocacy services, or even if there's other advocates out there that are watching this as well as our consumers and potential clients, how would they get a hold of you? What's the best way to reach you?
I would say calling me. It would, on my website, it has all my information. It's my email's on there. So my email is Hope Health Advocacy. I'm sorry, my website is hopehealthadvocacy.com. And then on there has all my contact information. LinkedIn, I'm pretty active on LinkedIn. So linking in with me is okay. I think that's how you did. Yeah. And
No, and that's
so
great.
I'm pretty flexible. Yeah, pretty flexible with that.
And so when, for those of you that are going to look at this video on our YouTube channel, I will in the video description put Michele's contact information there. So it'll be right there. You'll be able to click on the website. And so there'll be easy access for you. So Michele, in wrapping up, is there anything that we didn't talk about or anything that you would like to say about what you do? And I know you have something you'd like to share with us. So, but anything else you'd like to share, please, this is the time. So.
Sure. I think just everybody should be in tune with themselves. Some people do that a little better than others, but if something feels off, if you feel like there's too many medications, then maybe it's a time to get a good look at them. You know, and I'd be happy to help with that. I would say the quote, I wanted to finish with a quote, and it's on my website as well. It's one of my favorite ones, and it's by Harriet Beecher Stowe. And it says, never give up, for that is just the place and time that the tide will turn. So don't give up wherever you are in your healthcare journey. Get a resource, get an advocate. Pam too. She obviously does this work too. It doesn't have to be me, but you don't have to go through this alone. And patient advocates are a wonderful resource.
Well, thank you, Michele, for those kind words as well. And I love that quote. And I just wanted to say that we will have this video on our YouTube channel. So check that out at Your Nurse Advocate Consulting. And with that being said, Michele, it's been great having you. I appreciate you sharing your wealth of knowledge with us, and make sure everybody takes a peek at her website. And with that, we will call it a day for us. And thanks for stopping by and watching the video.
Thank you, Pam.